Hello, welcome to the CIRS Healing Collective Expert Guest Video Series. I'm Jenny Johnson, the host and facilitator of the CIRS Healing Collective, which has been a resource for aspiring CIRS overcomers to share and connect from around the world since 2020. I'm a Shoemaker Proficiency Partner and CIRS coach, and most importantly, an overcomer myself. What you're about to see is a 10-minute excerpt from a 90-minute group discussion that members of the CIRS Healing Collective got to have live with this expert guest. If you would like to see the full 90-minute replay, come on over to the CIRS Healing Collective. We have a robust video library from the past 5 or 6 years of so many expert guests. Better yet, you'll be able to join our future monthly live discussions with experts to come. We'd love to have you.
But Neuroquant. So here we go. Here's an example of one of the pictures of volumetric report with the Neuroquant. It is FDA cleared since 2006. It gives you a volumetric. So what does that mean? Size, shape, and weight of the different areas of the brain compared to age and gender of people with no symptoms. So for me, it would be a 48-year-old female with no symptoms. They would compare my brain to, right? It is also available in other countries, not just in the United States. And literally it takes less than 10 minutes after the brain MRI is complete. It's usually free, right? They usually do it because it's research-based. And we're going to start going over every area of the brain that we look at in the Neuroquant, because this is the biggest, I think, benefit for patients is they actually start to see where their symptoms come from. And so when you see a Neuroquant report and you see all the different areas of the brain that are listed, you can actually start to pinpoint the symptoms to where the atrophy or the hypertrophy is. And that gives patients so much credit that they say, oh my gosh, I've been feeling this for years. It's not just in my head. And I say, yes, it is, right? Because your brain's changing, but we can change that back. We've proven that with research that we can actually, with the vasoactive intestinal peptide, we can make the smaller areas more plump and the plumper areas smaller, right, as necessary. So the forebrain parenchyma, it's right here, right? It's in the front of the brain. You can see everything that it's related to here. Voluntary movement, logic, higher abstract thought, language, speech, right? Vision, hearing, touch, tinnitus, right? If you have ringing in the ears, you're going to see perhaps classic for CIRS is there's swelling in the forebrain parenchyma or hypertrophy. Motivation and emotions. When people say to me, I just don't want to get out of bed, I have no emotion anymore, I'm thinking to myself, forebrain parenchyma, right? Was as I'm talking to them, I'm always pinpointing what symptom correlates to the brain part that I'm looking at, because ultimately that's what I want to fix, right? I don't want to fix the symptom, I want to fix the brain. And then thermoregulation, when I ask, are you hot when others are cold or cold when others are hot? Yes, air conditioning can play a part of that in the heat, but if you're inside and you're always bundled up in a sweatshirt, right? Or you're sweating, menopause women, that can change, right? So i.e., there may be a little flexibility there, but, menopause can affect that, but that's still forebrain parenchyma. So, yep, pretty fantastic. And then amnesia, think brain injury. If they bump the front of their head and they're amnestic, you know that the forebrain parenchyma was involved. Or if they were hit in the back of the brain and the counter coup of that injury, meaning you basically shake up that brain like that, you know that there's an injury here and there's going to be an injury in the cerebellum. Okay, the cortical gray, simply put, it's the cauliflower. It's what the brain looks like. It's a cauliflower part of the brain, the cortical gray. And this is where all that good talking to the nerve cells happen, right? This is where all those synapses, all the firing we talk about, it's in the cortical gray. So when you start to see hypertrophy, typically you'll see hypertrophy with CIRS related to environment and CIRS related to bugs. You're going to see hypertrophy of the cortical gray. It also there's two areas, the dorsal gray horn and the ventricle. They just have the ventral gray horn. That's just different areas of the brain. But you can see, or the cortical gray, but you can see that they affect different things. So sensory information, when you hear kids who don't like touch, right? Or who don't like to be held, right? Or my daughter was a big one with this one, the tags or the seams, right? You'll start seeing that in kids or even some adults, right? You start to see, okay, what's going on? Where is this being affected? Those are all sensual symptoms. They are not skin issues, right? It's in here. When you start to see receiving motor information, so paralysis, tingling of the fingers and toes or body parts in between, right? When we start asking about paresthesias, and then muscle weakness as well. The ventricles. Now, this is the most fascinating part because we're learning more and more about the ventricles each day. But when I say to you as a patient, how are you sleeping? That's a loaded question for me. I'm actually going to be pulling out a lot of information when I ask you that question, right? Because I'm looking for light sleep, deep sleep, and if you're rested in the morning. You may not realize that, but that's what I'm looking for, right? Because when you get deep sleep, that's when the janitor comes out. Right. I don't know if everyone here realizes this, but sleep is the only time your brain detoxifies, right? Meaning that you clean out the brain, you take out the trash, if you will. So if you're not getting in good, deep sleep, that's the goal. Everyone talks about REM, which is important, but deep sleep, that's where the magic happens, right? So we're looking at anywhere from 15 to 30 to plus % deep sleep. I don't know if everyone sees this. I have a ring in my hand. I have the Oura ring. I love data and I'm always kind of biohacking on myself. And I evaluate my sleep every single day. It's about $200. It's not cheap, but it's a great way for me to track my own sleep patterns. And we can talk about that. I do not have any conflict of interest. I do not own it. I own an Oura ring, but I'm not involved in the company of Oura ring whatsoever. Okay, but you do have ventricles, and the ventricles are what fill with fluid in deep sleep. So when we start talking about, are the ventricles smaller or are they bigger than they should be? And you can actually see one side big and one side small, and that's a bad thing. That's not a bad thing, but that's not an ideal situation, right? Because that means one side's getting more cleaning than the other, if you understand my point, right? That's called normal pressure hydrocephalus versus hydrocephalus where the brain just swells, right? And why is that bad? Because we have bone, right? If our belly swells, that's okay because there's nothing hard surrounding it. We got hard structures around our brain. So there's 4 ventricles. You can see where they're listed. It is thought that the ventricles are actually enlarged during psychiatric illnesses. And again, portions of like potentially Lewy body dementia or different types of dementia aspects of that diagnoses. And you'll see progressive changes, volumetric changes over the years associated with that, with psych disorders, which is pretty fascinating to me. Okay, the hippocampus, this is where a lot of the magic happens, right? It's part of the limbic system. We talk about the limbic system all the time, right? Because of that stress response, right? How your brain talks to every organ in the system. This is basically what we're talking about, the hippocampus. It all starts here. It is in the temporal lobe of the brain, which is basically kind of like if you were to take a pole and put it up into your spinal column, you'd hit your hippocampus, like it's right in the center of your brain. This is where long-term memory happens, right? So short-term happens elsewhere in the brain and it converts into long-term in the hippocampus. So if you have an injury to the hippocampus, you're not going to have long-term memory, right? So when I asked you, how's your short-term versus long-term memory, people usually say, oh, my long-term's great. I can't remember what I did 2 days ago, right? Or they say, oh gosh, my long-term is really, really bad. I start to think what's happening in that hippocampus, right? Hunger, motivation, sex drive, right? Hippocampus, when we start giving people testosterone replacement, right? For energy, which I love doing, everyone needs energy. You start to see how does it impact that hypothalamus pituitary adrenal axis, which starts in the hippocampus, right? Pain, pleasure, appetite, pretty fantastic. And then memories. The amygdala, this is probably the most underappreciated part of the brain that I think neuroscience is just really starting to tap. Because number one, it's really hard to get to, right? It's really hard to test and to look at it without an autopsy, right? And we can talk about that, how they truly use diagnostic criteria is usually an autopsy, right? Because that's the only time we can actually really look at the brain, is unfortunately when the patient has passed. We can talk about that though, in the relationship to MRIs and how we can use them to diagnose. But dementia, believe it or not, the only way you can truly diagnose dementia is on an autopsy. So pretty fascinating there. Amygdala is associated with fear response and pleasure, right? Linked to anxiety, autism, depression, PTSD, different phobias, all related to the amygdala. And you can see where it is right there at the putamen and the caudate. It's right at the bottom. Okay, and then here is the limbic system actually in yellow. You can see it, and you can see the caudate. There's three areas of the caudate listed in this picture. And there's different areas, right? You don't necessarily have to know all the areas, but know that when we talk about Parkinson's disease, right? Or when I ask you about tremors, right? It's the caudate I'm looking at, right? That's what I'm thinking about. Because when I get that Neuroquant, I kind of do this little matching game in my head. Like when I see patients and I'm like, I bet you this is what I'm going to see on their Neuroquant, right? And then I already know what diagnostic criteria I need for CIRS. And I'm saying, I bet you it's, and I'll write a little note to myself. And when I get the Neuroquant back, I'll say, look, there it is, right? And it's all based off your symptoms, which is pretty fantastic if you think about it.